when we first started this program where we said out in the community, we want that community mental health provider to actually become the quarterback of care for these members.
That is Suzanne Kunis, who is the CEO of NovaWell Health, as well as the VP of Behavioral Health at Horizon BCBS in New Jersey. Now, you hear us harping all the time about how community health and behavioral health tech go hand in hand as far as innovation is concerned. There is mission there, of course, and there's also margin. Suzanne tells us exactly how and why in this patient story.
There was a patient that came through, agreed to be part of the program, and they explained why there's a value to it. And he's in early 30s and had an opioid use disorder and was looking to get into recovery and had been in the hospital 4 or 5 times during the course of the prior year with emergency room visits happening as well. And he was recycling through the system, overdoses, etc. He enters the program, and the first thing they did was they did a full battery of tests for a physical. So they checked your heart, lungs, liver, or blood pressure, but they also did a battery of blood work. At the same time, they did all the behavioral health assessments. And then they also looked at what's happening in your life. Had no job, no longer had a relationship with his family because of what was going on with his opioid use disorder. No place to live. And so his picture was not pretty. When they finished the testing and they looked at the results, there was something wrong with his thyroid. And so what did they do? Here's a guy, early recovery. The last thing he wants to hear is there's something wrong with me, other than what I'm here to deal with. But the folks that were there at the organization just literally embraced this guy and said, look, we need you to see an endocrinologist, I believe they went to. I'm not quite sure who they went to in the end, but they wanted to and they went with him to the appointment to make sure, A, that he went, and B, that he was comfortable, that he had support with him. Turns out he had thyroid cancer. So what did they do? Again, if you had an opioid use disorder and you're just in early recovery, you are going to probably just shut down and say, I'm just going back to where I was and I'm going to forget about all of this. The whole puzzle together.
So a big part of the innovation was like, look, we can put technology aside for a second and just talk about this overall model that where like if behavioral health is just happening in isolation and these other things are happening in isolation, there's not that incentive to address.
Exactly. That's what it's all about. So it's really our NovaWell's, North Star is all about integrated care, treating people as people, not conditions.
That sounds like it arises new metrics and things that you monitor.
Right.
Can you talk about some of the things that happen in aggregate and how that's communicated to leadership?
When we started to develop the program, we started off in one county in New Jersey, and we were going to wait for the program to run a year. We didn't have any data that says it was going to save money or any of those kind of things. We had data that said, my quality of life has changed dramatically. I am using X less than I used to do. This is all patient self-report, but it was hope. And so one of the things I learned early on, as long as people have hope, there's hope. And so when you start seeing those kinds of statistics coming through and people are saying they are getting better, they are getting better. Now, having said that, we also look at the data end of it. What we're seeing now is total medical expense, it reduced by 20%. That is a per member per month. That's huge, 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 huge. These individuals are generally running medical costs that are 3 times someone who doesn't have a behavioral health issue, 3 to 4 times. So we saw the total cost coming down. We saw 51% reduction in inpatient utilization. That's huge. 27% reduction in emergency room visits. But it all started with how the patients actually experienced what was happening with them and what the outcomes were from their perspective. Do the right things and the money will follow.
Y'all, that's not even half of what Suzanne covered. We went deep on how right now is the best time for mission-driven leaders to be able to find the margin to sustainably grow those important and very much needed community programs. You can search for us on our YouTube or our podcast, search for that episode. Or if you're already watching on YouTube, then just click the box on your screen.